A nursing SOAP note is a structured method for documenting patient care using the format: subjective, patient's reported symptoms and experiences; objective, measurable clinical findings and observations; assessment, nurse's clinical judgment and interpretation; plan, nursing actions and interventions. Standardization ensures consistent documentation practices across healthcare teams. Error tracking identifies documentation gaps and inconsistencies. Compliance maintains alignment with hospital policies and regulatory requirements. Digital efficiency streamlines the assessment process and report generation. Define the assessment scope by reviewing notes for completeness, clarity, and accuracy. Identify documentation gaps or inconsistencies and ensure alignment with HIPAA and Joint Commission standards. Select an eAuditor checklist that includes SOAP structure evaluation components. Assess legibility, completeness, and clinical relevance. Gather relevant data by accessing nursing records and patient charts and reviewing facility documentation policies. Subjective, S. Verify patient complaints and medical history are clearly documented, including chief complaint, pain levels, and onset. Objective, O. Confirm vital signs, physical assessments, and lab results are properly recorded with precise, factual data. Assessment, A. Review if clinical judgments align with findings and are clear, justified, and appropriately categorized. Plan, P. Verify treatment plans, medications, follow-ups, and patient education are documented and aligned with assessments. Automated report generation instantly generates SOAP note assessment reports, including photos, compliance ratings, and comments. Identify documentation gaps by highlighting missing subjective data or incomplete assessments. Recommend training sessions or updated guidelines. eAuditor streamlines the reporting process, providing clear insights for improvement while maintaining documentation standards. Assign corrective actions by notifying staff to address inconsistencies and implementing mandatory SOAP note training. Schedule follow-up assessments to conduct regular audits and maintain compliance. Update documentation policies as needed. Enhance staff training by providing ongoing education on effective documentation and reinforcing legal and ethical requirements. Regular documentation audits are performed monthly or quarterly to revise templates and meet evolving clinical needs. Promote documentation. Culture by encouraging precise, patient-centered documentation. Track recurring issues and address them proactively. A nursing SOAP note assessment using eAuditor ensures structured, accurate, and regulatory-compliant patient documentation, improving clinical communication and enhancing patient care.